You spoke about polypharmacy before, one of the 4 M's. Diagnosis of the reason for having polypharmacy and as an issue right now with older adults and community residents is that they have so many multiple medical comorbidities and their healthcare is not centralized. Sometimes we are the only provider for that patient at SUNY downstate and their providers are at different facilities. So we try to have to coordinate care and have those other providers send us a list of the patient medication, but also by asking the patient what exactly they have in their shopping bag at home, what are they taking daily, also helps us to coordinate and do a pretty good medication reconciliation. So polypharmacy results in adherence issue, of course, for older adults, not just for older adults, but for most persons that are taking many medications, keeping up with the intervals and dosage. Polypharmacy is defined as 4 or more medication daily, and that includes prescription medicines, over-the-counter medicines that we advise the patient or community resident to take or that they have bought and started themselves, herbal or nutritional supplement that they may not consider medication, but we want to know because there are interactions between over-the-counter medicines, some herbal supplements, some nutrition supplements, and prescription medicine. So we want to know exactly everything that they're taking. And our aim is to de-prescribe unnecessary medications for older adults to limit polypharmacy. So if they're taking 3 medications to treat constipation, that would come out in a medication reconciliation. Hopefully we could decrease it to 1, or if maybe there's a medication that we could completely eliminate to prevent the constipation. But while we're trying to de-prescribe and cut down the number of medications that older adults, our patients and community residents are taking, under-prescribing is an issue that we should try to eliminate. So that's when we think that because they're older adults or they may not benefit from using this medication because of the potential side effects. But we should always remember the adage of starting medications for anyone, but more so for our older adults and community residents, is to start at a low dose and titrate up slowly, observing for adverse medication reactions. Okay. Polypharmacy is associated with increased use, again, of multiple medications, higher healthcare costs, increased risk of an actual medication-to-medication interaction or medication-to-disease interaction, so having an interaction with other illnesses that they may be treating. Medication non-adherence, just keeping track of all the medication timing and the doses, and development of worsening multiple geriatric syndromes. And as I said before, to reduce and eliminate polypharmacy, we should identify, reconcile all existing medications that our patients or community residents are taking at every visit, every time, and evaluate the risk of medications that they're on, or also the risk and benefits of medications that we're starting. Because sometimes patients are on medications forever and they have no idea why, they don't remember why, but they know they've been on it forever, so they keep taking it. This is an opportunity for education and teaching during the annual wellness exam. Another ageism alert, preconception breed misconceptions. So we should identify whatever negative stereotypes we have of older adults, because that is causing ageism and that interferes with our interaction and our treatment for them and our recommendations, our healthcare recommendations for them. Sensory deficits, this is one of the misconceptions that's out there. Sensory deficits, vision and/or hearing difficulty is normal or expected as patients age, as persons age, which is not true. And most older adults are not sexually active, which is definitely not true. Okay? So this is an opportunity for teaching. As I said, when we assess our patients for sexual activity, it's not just to be nosy, but it's also an opportunity for teaching about safe sex practices, make sure they're practicing safe sex practice, they know what that entails to keep them healthy, and also to assess any history of sexually transmitted infections that may or could have been affecting their cognition or mentation.